Hey everybody, it's Dr. May. How are you doing? I hope you're ready to walk the middle path with me today because that's what we're going to be talking about. Okay, so we're doing the middle path module and specifically focusing on examples of dialectics. Okay, I did have another video where we went into depth about what dialectics are and including dialectical dilemmas and thinking dialectically. And we will go over that briefly today. But first, we're gonna mostly focus on examples. All right, but first let's talk about what the middle path is. So just as there's two sides of the street here, there's the left side, one side of the story, for example, maybe another side of the story on the other side. We're gonna walk between them, okay? So instead of one extreme or another, we're gonna kind of walk down the middle, and that's all about thinking dialectically and taking that middle path, okay? So the goals of the middle path module have to do with identifying dialectical dilemmas and learning to think more dialectically. And that's what we're going to do today. But also it has to do with one of the common dialectics they talk about in DBT, which is validation or acceptance on the one hand and making changes on the other, right? So let's get into the dialectical stuff today. So we're going to, again, focus on examples just so it's really clear about how they work. Okay, so anyway, just a quick review. What are dialectics? So dialectics are two things that seem like they're opposite and they have nothing in common, sort of like those faces there, like one looks really happy and one looks really sad, and they look like they're totally different. But in fact, both sides are actually true and valid at the same time. So this is a kind of a way we could approach life where it's never just one extreme or another. They have like a lot in common. Okay, so we're going to talk about today dialectical dilemmas and dialectical thinking. So dialectical dilemmas are what happens when you end up getting stuck on one side or the other. So if you have what, like you think something's all good and you forget that there's also some negative qualities, you're kind of seeing things in an imbalanced way. Maybe your emotions are telling you everything's great and everything's fine, and you're missing part of the picture. Right? So dialectical thinking, on the other hand, on the right side, is remembering that both sides exist and both have some validity. And when you keep both of them in mind, you could kind of come to a different conclusion, maybe a synthesis of both sides or a higher truth. All right? So that's what learning how to think dialectically is all about. All right, so here's one of the common ones, which I briefly talked about before. In DBT, they focus on some validation and acceptance strategies with the skills. So learning to accept yourself as you are with all your flaws and your goods and your bad, your positives, negatives, all the aspects of yourself. And at the same time, knowing that it's still possible to change, that you recognize that maybe not everything in your life is working for you. And although you accept yourself just as you are, you still could make things different or better, right? And that's what the change skills are all about. So trying to help you tweak a little bit and make things move in a better direction in your life. Here's another DBT one. Look familiar? This is the famous states of mind from the mindfulness module. So emotional mind, when emotions are driving the bus, when emotions are kind of ruling your thoughts, your behaviors, your decisions, versus reasonable mind, when your intellectualization kind of rules the way and you're just very focused on the facts and the objective science of things. Putting them together leads you to a synthesis of wise mind, which considers your emotions and some reason. And based on all of that, you come to a wise decision, right? So that's another DBT dialectic where you put both sides together. Whereas if you got stuck on one side or the other, you might have some more problems. Okay, another one that comes up in DBT is in the interpersonal effectiveness module. So we have give, which is focusing on the other person or the relationship, and fast, which is focusing on self-respect. So it's possible to focus on the other person as well as yourself. Or maybe at times it makes more sense to help someone out and spend a lot of energy on other people or another person, whereas other times you have to shift the balance and maybe take more care of yourself, okay? So on the left side, if you're too focused on caring for other people, the way to get to the middle ground, the middle path, is to wait a minute, I'm giving way, way too much. I have to also consider my own needs, right? Maybe I have to say no when necessary if I'm asked to be doing too much. On the other hand, if I'm too focused on myself, then maybe that's going to become problematic, right? Because I got to consider other people too. So I got to think about other people's needs and not just be self-focused all the time, right? So see how that balances out? Okay. So before I talk about this one, just to note that the Middle Path module was originally created to help teens and parents, because sometimes teens are on one side and parents are on another side, but they need to come together to make their relationship work. So the next few I'm going to go over are from that original teen parent, situation that we want to make better. Okay, so for example, from a teenager point of view, there's a kind of a dialectic between independence and dependence. So sometimes teens are really feeling their oats, right? You feel really ready to get out there and do it on your own and break free and break loose. But other times you might feel a little bit more like when you were little, like a little more scared or childlike, or, you need your parents to help you, or you need other people to do things for you, right? Or you're not sure if you can make it on your own, right? So they have to toggle back and forth between independence and dependence and sort of integrate, right? So maybe sometimes, you could be independent with certain things, but you also could ask for help when necessary. Or sometimes, you might be a little too clingy because you're scared of doing new things or doing things by yourself. But you could also, maybe take a risk, maybe trust yourself that you've built up some skills over time and do a little bit more than what you're used to doing, kind of make some steps toward independence. Okay, so think about if you're a teen, where you are on that side of the situation and maybe how you could integrate those better and come to more of a synthesis. But this also operates from a parent's perspective, okay? So sometimes a parent forces their teen to grow up before they're ready, and they make them have, like, maybe get a job or move out too quickly or be so responsible and not offer enough support. And the teen feels a little abandoned. They feel like, oh my God, I'm being forced to do too much and I'm not sure if I can do it, right? So in that case, a parent might need to help the teen, give them more steps and support toward independence. On the other hand, ever hear of a helicopter parent? Are you a helicopter parent? Uh-oh. So sometimes parents have a hard time letting go, right? They're used to their kid being younger, maybe doing more for them, or not being able to trust them yet, being afraid to let go, right? So sometimes if they foster too much independence, parents need to recognize the age and maturity of their kid and maybe slowly help them become more independent. Okay? All right, next one. So this could apply in a household, but also could apply in other settings too. So talking about discipline and rules, sometimes we too strict, other times too loose, or sometimes we bounce back and forth between the two. So let's say on the left, the parents being very strict, okay? And, maybe there's too many rules about too many different things and the teen's feeling kind of stifled, right? On the other hand, sometimes, parents are afraid to set limits, like they don't want to make their kid mad or get them upset or like not do what the other parents are doing. So there's not enough rules, or maybe there's no rules or boundaries at all. And kids, or teens just end up doing whatever they want, but maybe that's not the wisest thing to do. So if you're a parent and you're being a little too strict, maybe just lighten up a little bit. Think about what are the most important health and safety rules, and are there some things I could let go? Maybe, it's too much based on the age and maturity of my teen. Maybe I could lighten up a little bit and take some of my fear out of it. On the other hand, if you're too loose and you're afraid to do discipline, maybe get support from somebody to help you have courage to, set a few guidelines. Even if it's some basic ones, it makes the teen feel more supported and safe. So it's always important to put a few things in place as, they're feeling their way through. Okay, so another thing to keep in mind is that you might be so loose and let things go, and then something bad happens. Then all of a sudden you swing the other way and you start saying, that's it, you're grounded for 3 months and you can't go out and you can't have your phone and you can't do anything, right? And then it's so strict and overdone that you have a hard time following through with it. So after a week you say, all right, forget it, you can go out with your friends again. Okay, so if you're gonna come up with some rules, it should be things that are fair, and that are enforceable and you actually follow through with. So always keep that in mind. And if you're not sure, if you're the parent, maybe get some support from somebody else, okay? But as a sidebar, I also see some things like this sometimes happen even in a hospital setting, right? Sometimes there's like, we let certain things go and patients are allowed to do more than they're supposed to. And all of a sudden administration comes in and says, wait, we gotta crack down, right? So there's that moving from too strict to too loose and back and forth. All right, so we're trying to walk that middle path, have something fair and doable and in the middle. All right. So here's another thing that happens with parents and kids or parents and teens, plus in other relationships. All right. So I rephrased it a little bit from the original, but I'm going to say making a big deal out of minor things versus ignoring important things. Okay. So another version of that is making, too much of normal behaviors or pathologizing, making too much of normal behaviors or, dismissing, self-injurious behaviors, for example. All right. So you got to get your priorities straight. That's the main thing. So if something's minor and you're freaking out, maybe you got to lighten up a little bit, right? If your kid is cutting and you're ignoring the cutting, but then you're screaming at them for leaving clothes on the floor, seems like a little out of whack, right? So sometimes when your emotional mind's running the show, that's what happens. It goes inside out. So if you're overreacting or you think you're overreacting, maybe talk with someone to see if they agree, and use some coping skills to get out of emotional mind if you need to, and try to think of what you could let go. What's really not that important, especially in the big scheme of things. Use your give skill, maybe preserve the relationship over getting what you want, which may be something really minor that's over controlling anyway. On the other hand, if there is something important, you should have the courage to address it or get support while you address it with the person. Okay. So for example, if there's drug use, you shouldn't just ignore it. You should bring it up. Or if there's self-injury, you need to deal with it and bring it up. Don't just pretend it's not happening and then, pick on something really small. Okay. So we got to get our priorities straight. Okay. So now I'm going to move on to some dialectics that are not necessarily parents and teens, but it could be anybody, maybe someone who's in DBT of any age. Okay. So first, a skills dialectic. Okay. So I've heard this quite a bit over the years. So on the one hand, sometimes people are overconfident. Yeah, I've used DBT skills before and, I'm feeling good now. I'm good. I don't need to be in this treatment anymore and I'm fine and I don't need help and I don't need to do a diary card and da-da-da, right? On the other hand, on a different day in a different mood, the very same person may be like, I have no idea what to do. I can't cope, but my life is falling apart. I have no idea, right? So if you're overconfident, you got to remember that while you might be feeling that way now, there still could be more challenging things that come up. So it's still important to learn and practice your skills because you never know when you actually might need to apply them, right? So you haven't mastered life yet, chances are, none of us have. So, take what you can and just maybe apply it more thoroughly, okay? Because it's easy to know it here, but it's hard to put it into action. So it's the putting it into action part that always needs the work. So watch the overconfidence, okay? On the other hand, if you're in a mood where you feel like you have no idea what to do and you completely forgot your skills, you have no idea what to do with them, maybe ask for support or skills coaching, but remember that maybe you've had some successes. Maybe there are skills up there, and with a little bit more support or assistance or, brainstorming, you could figure out a way through it. Okay. So don't declare helplessness before you really give it a fair try. All right. So next, this comes up for everybody in life, right? Transitions are always one of the hardest things we have to deal with. Okay. I remember someone telling me once that even for kids, like let's say in school, the transitional parts of the day are the hardest parts of the day, right? Getting the kids from the classroom to the lunchroom, from the lunchroom to recess, from recess back to the classroom, right? Lining people up, getting to be quiet, getting them to move together. That's always the transitional parts that are super hard. but we never really outgrow that, even when we're not kids. Like transitions are really hard. The change could be really hard. So going with the change versus stability. So change, sometimes we feel overwhelmed by change, like there's too much changing in our life. Maybe this just happens to be a bunch of things shifting at once, and we feel uncertain and vulnerable and overwhelmed, and we don't know how to do it, right? On the other hand, if things are too stable or too boring and there's not enough excitement, you might start to feel really bored, okay? So how do we get to the middle ground, to the middle path? If there's too much change, try to think of something you could build into your routine that will make your life feel a little bit more stable, right? So maybe even if you moved, even if you got a new job, even if you went from school to summer vacation or something shifted, find something that makes you feel safe. Routines make you feel safe. Maybe meeting with the same people makes you feel safe, or having a certain ritual, not a dysfunctional ritual, but like a healthy ritual, maybe exercising every day, and having that routine makes you feel safe or makes you feel stable, right? So put some sameness into the life with the change. At the same time, on the other hand, if things feel too stable, too stagnant, too boring, try to think of something new you can do. Even if you're, let's say, stuck in the hospital and things are kind of, routine and the similar stuff happens every day, maybe you could still do something new. Maybe you could try new skills meanwhile. Or maybe you could read a book about a new topic. Or you could interact with a different person, right? Or shift something, even if it's something small. So at least you feel like things are moving, right? So things are interesting, all right? Next, this is more for if you're inpatient, but you could kind of like shift this around and think about another change, such as graduation or moving or something like that. So one of the anxieties that comes up for people who are inpatient, and I know some of you watching are inpatient, is the transition from being in the hospital for a long time to getting discharged. So people often fall into one of two camps. One, the people who say, I can't wait to get discharged. I got to get out of here. I don't belong here. I want to go home, all that stuff, right? And they only show excitement for discharge. And if you ask them, how do you think it'll go? Oh, it'll be great. Once I get out of here, I'll feel better. My life will be better, all that stuff. On the other hand, there are the people who are terrified of discharge, that sabotage their progress just to stay in the hospital because the change is so scary, right? And they're afraid that they won't make it, or maybe that they're gonna be out of their hospital routine and that's too scary, or maybe they've been discharged before and it didn't work out and they're afraid of the same thing again, or they're not sure what kind of a life they're gonna have out there, and just facing it makes them anxious. Okay, so let's say you're in the camp where you can't wait to discharge and you think everything's gonna be great and fine, kind of an idealized picture. You still have to remember that there might be some challenges to face, right? So prepare for that. Maybe cope ahead. Think about what those challenges might be and talk to someone about how you can work them through. All right, so it's only fair to recognize that life isn't just perfect once I get to this place, okay? If you're too anxious about discharge, remember the things that led the staff to believe that you're ready for discharge. Maybe you've gotten a lot better. So when you do get out, you'll be in a different place than you were the last time. Maybe you're on better meds now, or you learn more skills, or you worked on yourself more. So it could be different this time. It's only fair to give it a chance. So don't forget to use what you've learned as you prepare for it, and believe that it will be in place once you get out. Okay, next, a relationship dialectic. So you could just feel the emotion mind in this. So on one hand, if it's a tumultuous kind of relationship, you might be in a mode where the person could do no wrong. You love them, they're great, there's no problems, we're gonna be together forever, all that stuff, right? On the other hand, so a little something goes wrong and now it becomes, oh, I can't stand him, why are we together? He's a jerk, we should break up, I don't wanna be with him anymore, right? And then you're in a better mood and it switches the other way again. All right, so how do we come down the middle? Remembering that love and hate aren't really opposite, right? They're a collection of feelings that can happen in the course of a relationship, right? And they're all part of the picture. So when you're in one mode, you have to remember that the other still exists somewhere. So even when you're idealizing the person and you think you love them and everything's great, remember that sometimes you still do have problems, right? It's never perfect. Or if you're in the mode where I can't stand him, I hate him, this is the worst guy ever, remember that maybe you're just in a bad mood today, or maybe you just had a rough day, but there's other times when things really are good. So don't do anything rash, like break up with the person if it's not the right thing to do. All right, so balancing your emotions in your relationship and valuing the relationship over the fluctuating feelings. Okay, here's a common one. Has to do with shame in a lot of ways. On the one hand, entitled. So feeling that you're special or you deserve special treatment or that people owe you something, okay? And on the flip side, usually what's underneath the feeling of entitlement is feeling undeserving. Like you're just a piece of crap, like that you don't deserve anything, that you have low self-esteem and you know, you can't even believe that people like you, right? So that's like that really low shame feeling. All right, so sometimes people make up for that and overcompensate by acting like they're great and special, you know, or sick and special, or grandiose and special. Okay, that's the entitled. So we have to thread that down the middle as well. Okay, so would it be fair to say that we're all okay just because we're human beings? That deep at the core of us, we're decent people, and we don't have to overcompensate and act like we're too special, and we don't have to, you know, hide from the world and pull the covers over our head because we're total pieces of crap, right? That we're actually have positive and negative qualities and we're worthy just because we're human beings, okay? So if you're too entitled, it's important to develop a sense of humility. What does humility mean? What does human come from? The root comes from humus, which means earth. So when I'm walking on the earth, when I'm of the earth, I'm just a regular person with positive and negative qualities. So remembering that helps you get past these extremes, right? If you're feeling undeserving and feeling like I'm not worth anything, you still got to remind yourself like, it's okay, I'm worth it, right? All right, really important one. Okay, often comes up with anger, all right, blame, all right? Blaming yourself, which actually is also tied into shame, or blaming other people. So it's my fault or it's your fault. So what's the dialectical way of thinking about this? Maybe we both had a role, right? Maybe I did some things that weren't so great and you did things that weren't so great and we weren't our best selves and we both contributed to this problem and we both have to own up to our sides, right? So that's a little bit more fair, right? It's a little more dialectical. And we think about it that way, the emotion goes down, right? Once you start that you did this and you did this, or it's all my fault and I'm a terrible person, then the emotions start escalating, all right? So we got to watch. All right, here's the last one I think I'm going to do. All right, hope you're still with me. Blind trust versus suspicion. So these sides come up whenever you have trust issues, and you probably do both from time to time, okay? So blind trust is when, you know, all of a sudden you feel a little taste of the person has an interest in you, even if you don't know them that well, and you immediately feel like maybe the person's trustworthy and you start spilling your guts to that person. So you could be waiting online at the grocery store and the person in front of you seemed nice and all of a sudden you're telling them that I was abused when I was 5 years old and, you know, it's too much, right? And why would you tell too much to somebody you don't even trust, right? But in the moment you can get caught up in it and get a little emotional about it and it feels just like the right thing to do in that moment, but then later you might regret it. And it also might make the other person uncomfortable, okay? On the other hand, if you're too suspicious of people, you put up too many walls. You don't let anybody in. You might think that the person reminds you of somebody that wasn't trustworthy, but maybe they actually haven't done anything to take away your trust. Maybe you're just, you know, being overly cautious and you're not giving someone a chance. So you're being too suspicious about their motives or too afraid that they're going to hurt you in some way, right? So we have to be fair about it. So what's a fair way to establish trust? Well, we got to give it time because trust is when someone's acting consistently respectful over time and kind and, you know, keeps secrets for us if we need them to, you know, maintains confidences where it's appropriate, is, you know, sees us in our, you know, sees our true self behind all our flaws and respects us. So we can't just judge that in a couple of minutes, right? So blind trust wouldn't necessarily make sense. But if I slowly reveal myself over time, test the waters, and see how the person reacts, and the person is consistently, giving me evidence that they're respectful of me and that they treat me kindly, then I could start to legitimately build trust. Okay. So that's what happens. That's a way to go if you have trust issues, so that you don't flip flop from one extreme to the other. Okay. And that's the end. All right. So I hope that this series of examples made dialectics a little more understandable to you. Dialectics isn't a skill where we just kind of keep bringing up examples and running through examples, but I just wanted you to know how it works, so that in your everyday life, you can spot these examples, right? So if you can spot a situation where maybe you're stuck on one side or someone else is stuck on one side and there's something missing and you need to see things more fully in a holistic way, then you can say, oh, I think there's a dialectic going on. How do we work this through? All right, so that's really how dialectics are more organically worked into a situation. Okay, but I just want you to see some common things that come up so you get a better sense of how to apply it to your life. All right, so that being said, thanks for listening, and stay tuned for more stuff. All right, have a good day, and I'll see you next time. Bye, guys.